continue. Okay. Hopefully you guys, said it's okay to record. Yay. All right. We're going to get this started. So if you guys want, I'm going to set up a timer. You guys can look at the title, get some little foreshadowing. What's he going to talk about? And you'll see. Okay. Cancel. Okay. Obesity is a medical condition, but not quite medically covered. What these mean? I don't know. Let's find out. Okay. I'm going to start my timer right now. Okay. When I think of the word domination, I think of McDonald's. One restaurant has 13,797 locations in 5,005 cities in all of the states/territories in America, except for Virgin Islands, America Samoa, and Puerto Rico. But still, however, something else is starting to dominate America, and at a faster rate than McDonald's: obesity. My goal in life is to revolutionize the fitness world, and for me to do that, I need to tackle obesity in America. Because as a personal trainer and kinesiology major, I know it's impossible to outwork a bad diet. You just can't do it. Obesity is very deadly because it's associated with so many other disorders from it: hypertension, diabetes, cancer, list goes on and on. And with at least 1/3 of Americans being obese, chances are you care about someone that's obese, or you might be obese yourself. So a little overview. During this presentation, I'm going to talk about the growing pandemic of obesity in America, causes, and why we should expand health insurance coverage for obesity. So obesity, what it is: in the eyes for Centers of Disease Control and Prevention, a person is considered obese if they have a body mass index of 30 or above, in which the US had the highest mean BMI increase out of all the high-income countries in the world. Great, right? And the percentage of obese Americans has been increasing as well. In 2006, it was 36.3%. Moving to 2016, it goes to 41.6%. In just 10 years, that's a 5.3% increase in population of obesity, meaning roughly 17 million more people were considered obese. That's, now you're thinking, why does it matter if we're obese? Well, there's some health risks associated with it. First of all, let me just say, no one is immune to obesity. Any group, demographic, ethnicity can become obese. No one is safe. For example, a multi-ethnic, multi-site cohort study from the Women's Initiative on women aged 50 to 79 showed that women with a BMI of 33.1 or higher had a 2.5 times more likely chance to develop breast cancer compared to women with a BMI of 22.6 or less. This is just a little study. I want to say that anyone can be affected. Doesn't matter what group or study. This one I came up with, or not came up with, but wanted to share. Anyways, with millions of cases of obesity and other disorders influenced it, millions of dollars are being used. In fact, billions. The president/CEO of Cleveland Clinic, Dr. Cosgrove, in 2005, mentioned America's weight problem has huge ramifications on the economy and healthcare, and that our healthcare expenses, let alone 10%, is for obesity, and it's projected to be 20% in 2020. Well, let's fact check that. From the Organization of Economic Cooperation and Development, they conducted a global study of high-income countries, finding the healthcare expenses per country. For America, our expenses of healthcare, 14% of it goes to obesity. So not 20%, but still increasing. Now, what's an actual value? What's the value? What does 14% mean? A study conducted from Rosenberg Rao J, hopefully pronounced that right, all the treatments, consequences, struggles of obesity, all of that totaled, estimated, that's the annual medical cost of $149.4 billion. That's insane. And money can be lost, but it can be recreated quite easily. That's not the same for humans. 1 in 5 deaths are contributed to obesity, nearly as many as smoking, according to the American Journal of Public Health. Now, what are the causes of obesity? How did people get obese in the first place? Well, there's a lot of problems, or causes, I guess I should say, but more prevalent than others. One is proper nutrition. Proper nutrition is very hard to achieve because it's very specific to each person. Fat storage and body weight interactions are determined between metabolic, genetic, environmental, psychological factors. There's so many factors that come into play. Not to mention, there's things we still don't know about nutrition. The American Society of Nutrition identified the top 3 nutritional research needs as variability of individual responses for food and diet, the role of nutrition on growth, development, and reproduction, and the impact of nutrition on health maintenance. So there's things that we need to still figure out. So how is America handling obesity right now? Well, not the best. That's why millions of Americans are still struggling with obesity. This is why, from a study from the National Opinion Research Center in Chicago University, found that 81% of Americans see obesity as a very serious health problem in America, surpassing mental illness, AIDS, and heart disease, and tying with cancer at 81%. Now, health insurance now is actually not as bad. Some states have expanded coverage for obesity, but not all of them. So a possible solution is to unify all 50 states to get health insurance for obesity with multiple different approaches. Now, why is this a solution? Why is health insurance going to help? Well, millions of people are struggling and millions of dollars are being used. If we can expand health insurance coverage for obesity, all 50 states, these would give the ease and kind of motivation to millions of people struggling with obesity, saying, hey, we got you, we're going to help you. It's going to help them in the long run, I promise. And a majority of Americans, not to mention, want help with obesity, and they want it to be covered. A study from the National Opinion Research Center, again, another study, they found that Americans want coverage for doctors helping them with obesity through diet and exercise at 78%. They want stomach surgery to be covered, 75%, and also one-on-one dietary counseling at 73%. They want all of these to be covered. How do we get this now? If this is a solution, how can we make this happen? First, we need to keep the Affordable Care Act, because the Affordable Care Act helps states make statewide guidelines on insurance coverages like they've done before. Second, what's something me and you can do? Well, public policy. It all starts from the people, right? First, if you're passionate about a problem, if you're passionate about obesity and care about the lives of obesity people, you need to bring it to a local representative. City, state, district, doesn't matter. Bring awareness. Once awareness is brought to an issue, enough people behind it, a policymaker put it on their agenda. Once it's on their agenda, they talk about it, and then hopefully they send it to Congress, and then Congress hopefully makes it a bill. What would happen if this were to come to fruition? Well, millions of lives and dollars could be saved. If insurances were to expand their health insurance coverage for obesity in all states, then millions of people can be having a healthier life and be saved from premature death, cardiovascular disease, and we can save billions of dollars. A study for Medicare beneficiaries showed that if they were to extend their health insurance expansion for obesity amongst elderly Medicare beneficiaries, they could save up to $23 billion in over 10 years. That's insane. And just to mention weight loss and legislation, the timelines, if we were to get these laws passed, you don't really know. It could take months to years. It really depends on the person to meet their goals and diet and self-motivation. Same thing with legislation. If it even gets to Congress, it can take months to years, decades, even if it is passed. We don't know. So hopefully, in the end, you guys know that obesity is a problem in America, its causes, and how expanding health insurance could be the solution. In conclusion, millions of people need help. They need it. They're fighting. Odds are, with 1/3 of Americans being obese, you know someone. You should care about someone that's obese, hopefully. So talk to a local representative. Bring awareness to this problem. Ask for health insurance expansion for obesity. And help me save millions of lives from death, cancer, hypertension, diabetes. List goes on and on of complications. And ultimately, let's give these Americans a healthier life. Thank you. Woo! 7 seconds left, baby. So that's 7 minutes, 53 seconds. Right under 8 minutes, my timeline. All right, that is it, y'all. I'm gonna stop sharing my screen.
Can you hear us now?
Yeah, I can hear you.
Awesome.
Good job.
That was
what a passionate. I
couldn't have said it better myself.
That was 7 seconds under the time limit, so on the edge.
Time limit is, what was the time limit?
We have 8 minutes.
Oh, good job, Baylor. What a speaker. Wow, how charming.
Yeah. So I'm gonna.
Taylor, when you're going to do big things in life, don't forget us. All right. Don't forget us.
Baylor, don't be fake.
Yeah, I won't.
Damn.
Yeah, I promise. Okay.
Taylor, just remember, I recommended you Code Geass and you loved it. All right.
Yeah, I know. I remember.
Just saying.
Stuff. Don't worry.
Just saying.
Just saying. All right, I remember. Just keep in contact with me, guys. All right. Anyways.
I got you.
That's it. You guys can go. Oh, Alex already left. I think he really wanted to speak.
Damn, wait, really?
Yeah, he left. But anyways, thanks, y'all. I might need your help with my last speech in, I think, next month, in a month. But
hey, man, that's fine.
Thanks, y'all.
Whenever, man. You just ask. All right, I'll talk to you later.
Yeah, see y'all.
Peace.
I appreciate it.
Peace.